The key is go here in a circular fashion to make every dimension, every centimeter of this marshmallow get an equal amount of heat. Precision s'mores. Kind of like precision eczema, huh? Precision medicine.
Eczema is not precision. It has its own, a mind of its own, right?
Do you feel like people understand? When you say, oh, I have eczema, do they understand the seriousness and how much it has affected you?
No, I don't think they do. I think we tend to think of eczema as a super cosmetic problem, and, you know, an annoyance. And in fact, it can really impact your quality of life. What about you? You also have eczema.
I have eczema also.
Yeah.
I was that person that was really uncontrolled as a kid, especially. There's things like grass, etc. Really set me off. I had asthma as a kid too. People don't think about it, but if you're itching, you're not sleeping, you're gonna, if you don't sleep, you're gonna have anxiety, you could have depression, you could have so many problems. And when I tell my friends even now that I study eczema, I treat itch, sometimes people laugh. I say, oh really, you're like a doctor, that's what you're treating. I'm like, do you even understand how significantly this disease can affect people's overall life, quality of life?
You know, I think as a doctor, you're probably trained to address what you see as the acute problem, and perhaps less trained to address the impact of the disease on our lives. You know, we're also trained in this culture to really respect doctors and to think that they're busy people. And so there's almost a sense that you might inconvenience your doctor with these details, which aren't, you know, directly related to how the eczema is behaving, but it's rather the eczema's, you know, impact on you. And so as a dermatologist, if someone comes to you and they're really struggling, their mental health is really taking a hit, like, can you even screen? What can you even do?
Yeah, no, it's a great question. And it's such a common comorbidity. And I think it's a great opportunity in that moment for an intervention. And it can be very simple as to acknowledge and know that it's not something that should be stigmatized. It's not you alone. This is very, very common. And it's very important that we put a lot of good emphasis on getting this better. There are treatments that will help by helping your itch. There's also things that we can do outside of the itch. But you're right, it's very hard to get to stay within our scope of practice as well. But the really cool thing is a lot of the new therapies that are being prescribed also have data on how they can improve anxiety and depression. And so that can also help counsel patients, so that people who use this therapy also found that their anxiety and depression improved. Would that not be something helpful to know about before you're picking therapies?
It would be so helpful to know that.
And there's data available. And I think docs don't think that's important for patients, but I think we just uncovered that's something important for docs to be talking to patients about.
Yeah,
So,
absolutely.
very important.
And it would
to discuss
influence my choice of a course of treatment.
Wow. Oh, that's good.
Can I confess to you, I really think the chocolate and the graham cracker is ancillary. I really only want to eat this marshmallow.
Oh, really?
Yeah.
I'm the opposite.
Yeah.
I'm like super chocolate and cracker focused right now.